Have you ever successfully treated your ball of foot pain only to have it come back a few months later? Maybe you've been through this cycle multiple times, getting relief, thinking you're finally done with the problem, then having the pain return just when you thought you were in the clear. If this sounds familiar, you're not alone. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas, with over 25 years of experience treating foot and ankle problems. In my practice, I see patients regularly who have been through this frustrating cycle of temporary relief followed by recurring pain. Welcome to the final module in our Ball of Foot Pain 101 series. Today, we're focusing on the most important topic of all, how to prevent ball of foot pain from coming back for good. The truth is, most ball of foot pain is preventable. The key is understanding why the pain keeps returning and making the right changes to break that cycle permanently. By the end of today's module, you'll have a comprehensive prevention plan that addresses not just your symptoms, but the underlying factors that caused your pain in the first place. Before we get started with these prevention strategies, I want to remind you that I've written a comprehensive book all about foot pain that gives a detailed prevention guide on how to prevent ball of foot pain. You can get it completely free at www.balloffootbook.com. Also, if you find this information helpful, please like this module, hit the subscribe button, and share it on social media. This helps others who are struggling with foot pain to find the relief they need. Let's start by understanding why ball of foot pain keeps coming back. The fundamental issue is that most people focus on treating the symptoms without addressing the underlying causes. It's like having a leaky roof and just putting buckets under the drips instead of fixing the actual hole. The role of foot mechanics cannot be overstated. Your feet are complex biomechanical structures that need to function properly to distribute forces evenly. When there's a problem with how your foot moves or how weight is distributed, certain areas get overloaded while others are underutilized. Think about it this way. If you have a car with misaligned wheels, you can replace the tires when they wear out unevenly. But if you don't fix the alignment, the new tires will wear out in the same pattern. The same principle applies to your feet. Repetitive strain is the enemy of long-term foot health. Every step you take puts forces through your feet, and if those forces aren't distributed properly, the same areas get stressed over and over and over again. This is why people often develop the same problems repeatedly. They're not addressing the mechanical issues that caused the problem in the first place. Unchanged gait patterns and shoe habits are major contributors to recurring problems. If you go back to wearing the same types of shoes that contributed to your original problem, or if you maintain the same walking patterns that created excessive stress, the pain will inevitably return. This is why comprehensive prevention requires a multifaceted approach that addresses mechanics, footwear, daily habits, and ongoing maintenance. Let's start with smart shoe choices, because this is one of the most important factors in preventing ball of foot pain recurrence. The shoes you wear every day have a profound effect on your foot health, yet most people don't give them nearly enough consideration. When you're shopping for shoes, there are several key features to look for. First, adequate depth in the toe box is crucial. Your toes should have enough room to move freely without being compressed. If you can't wiggle your toes comfortably, the shoes are too tight. Width is also important, especially across the ball of your foot. Many people focus on length when buying shoes, but width is often more critical for preventing ball of foot pain. The shoe should accommodate the widest part of your foot without creating pressure points. Forefoot cushioning is essential, particularly if you've had fat pad problems in the past. Look for shoes with adequate padding in the ball of the foot area. This doesn't mean the shoe needs to be thick or bulky. Modern shoe technology allows for excellent cushioning in relatively sleek designs. The heel height makes a significant difference. High heels shift your body weight forward onto the ball of your foot, dramatically increasing the pressure in this area. If you must wear heels for work or special occasions, try to limit the height to 2 inches or less and limit the time you spend in them. Arch support is important for maintaining proper foot mechanics. Shoes with good arch support help distribute weight more evenly across your foot and can prevent overpronation that contributes to many ball of foot problems. Now let's talk about insoles and inserts, because this is an area where there's a lot of confusion. Over-the-counter insoles can be helpful for some people, but they're not a one-size-fits-all solution. Generic arch supports or cushion insoles might provide some comfort, but they don't address the specific mechanical problems that caused your ball of foot pain. Custom orthotics, on the other hand, are designed specifically for your feet and your particular problems. They can address biomechanical issues like overpronation, provide targeted pressure relief, and help maintain proper foot alignment during walking and running. The role of metatarsal support in orthotics is particularly important for preventing ball of foot pain recurrence. A properly placed metatarsal pad or bar can help redistribute pressure away from sensitive areas and maintain proper spacing between your metatarsal bones. For people who have had Morton's neuroma, custom orthotics with metatarsal support can be crucial for preventing recurrence. The orthotic helps keep the metatarsal bones properly spaced, reducing the likelihood of nerve compression. Daily habits play a huge role in maintaining healthy forefoot function. Let's talk about some specific things you can do every day to keep your feet healthy and prevent problems from returning. Stretching and strengthening exercises are fundamental. Calf stretching is particularly important because tight calf muscles contribute to many ball of foot problems. When your calf muscles are tight, they prevent your ankles from bending properly, which forces your foot to compensate by putting extra pressure on the ball of your foot. I recommend stretching your calves at least twice a day, once in the morning and once in the evening. You can do this by standing facing a wall, placing your hands against the wall, and stepping one foot back when keeping your heel on the ground. Hold that stretch for 30 seconds and repeat on both sides. Toe exercises are also important for maintaining strength and flexibility in your forefoot. Simple exercises like toe curls, where you try to pick up a towel with your toes, can help strengthen the small muscles in your feet. Towel scrunches, where you place a towel on the floor and scrunch it up with your toes, are also excellent for building foot strength. Weight distribution and posture awareness can make a significant difference in preventing ball of foot pain. When you're standing, trying to distribute your weight evenly between both feet and avoid putting excessive weight on the balls of your feet. Be mindful of how you stand throughout the day. Many people have a tendency to shift their weight forward on the balls of their feet, especially when they're concentrating or working at a standing desk. This constant forward weight shift can contribute to ball of foot problems over time. Avoiding hard flooring while barefoot is crucial, especially if you had fat pad problems. Hard surfaces like tile, concrete, or hardwood provides no cushioning for your feet. Even just wearing supportive slippers around the house can make a big difference in preventing foot pain recurrence. If you have worked in an environment with hard floors, consider using anti-fatigue mats where you stand. These mats provide cushioning and can significantly reduce the stress in your feet during long periods of standing. Let's talk about advanced prevention tools that can help ensure the long-term health of your foot. Orthotic tune-ups and annual reassessments are important because your feet change over time, and your orthotics may need adjustments. I recommend having your orthotics evaluated at least once a year to ensure they're still providing optimal support and pressure relief. Sometimes, minor adjustments to your orthotics can make a big difference in preventing problems. As your feet change with age or activity level, your orthotics needs may change as well. Supportive footwear for home use is often overlooked, but incredibly important. Many people are very careful about the shoes they wear outside, but then walk around barefoot in an unsupported slipper at home. Since you spend a significant amount of time at home, having proper foot support during these hours is crucial. Look for slippers or sandals with good arch support and cushioning. There are many attractive options available now that provide excellent support while still being comfortable for home use. Maintaining a healthy weight is important for overall foot health. Excess weight puts additional stress on your feet, particularly the balls of your foot. Even modest weight loss can significantly reduce the pressure on your feet and help prevent pain recurrence. Regular foot care and monitoring is also important. Pay attention to any changes in your feet, including skin changes, new areas of callus formation, or changes in toe position. Early detection of problems allows for prompt intervention before they become serious. Now let's discuss when you should follow up with professional care. Certain groups of people should be monitored more closely to prevent recurrence of their problems. If you've had a Morton's neuroma treated, whether with conservative care, injections, or surgery, regular follow-up is important. Neuromas can reoccur, especially if the underlying mechanical factors aren't addressed. Annual checkups can help catch an early sign of recurrence. Patients who have had capsulitis should be monitored regularly. Capsulitis can progress to more serious problems like plantar plate tears if not properly managed. Regular evaluation can help ensure that this condition remains stable and doesn't progress. If you've had fat pad restoration with liposana injections or other treatments, periodic follow-up can help assess the long-term results and determine if any additional treatments are needed. People with certain foot types or biomechanical problems may need more frequent monitoring if you have a high arch, flat feet, or significant overpronation. These conditions can predispose you to developing ball of foot problems. Regular checkups can help catch problems early before they become symptomatic. Let's talk about some specific prevention strategies for different conditions we discussed in this series. For Morton's neuroma prevention, the key is avoiding nerve compression. This means wearing shoes with adequate width, using metatarsal pads when needed, and addressing any biomechanical problems that contribute to nerve compression. If you've had a neuroma treated successfully, continuing to use your metatarsal support in your shoes can help to prevent reoccurrence. For capsulitis prevention, addressing underlying mechanical factors is crucial. This often means treating equinus with regular calf stretching, using orthotics to control overpronation, and avoiding activities that put excessive stress on the toe joints. For fat pad atrophy prevention, protecting your remaining fat pad is important. This means avoiding excessive high-impact activities on hard surfaces, wearing well-cushioned shoes, and using padding when needed. If you've had liposana injections, following the post-treatment guidelines can help ensure the best long-term results. I want to emphasize that prevention is not a one-time effort. It's an ongoing process. The habits you develop and maintain over time will determine whether your ball of foot pain stays away for good. Consistency is key. It's better to do simple prevention strategies consistently than to do complex routines sporadically. Simple things like wearing supportive shoes, doing daily calf stretches, and being mindful of your foot health can have a profound impact over time. Let's talk about some common mistakes people make when trying to prevent ball of foot pain recurrence. The first mistake is thinking that once the pain is gone, the problem is solved. Pain relief doesn't necessarily mean the underlying problems has been fixed. You don't address mechanical factors that cause the problem, it will likely return. Another common mistake is gradually returning to old habits. Maybe you start wearing your old shoes again, or you stop doing your stretching exercises. These gradual changes can lead to a slow return of symptoms that might not be noticeable until the problem becomes significant again. Ignoring early warning signs is another mistake. If you start to notice any return of symptoms, even mild ones, it's important to address them promptly rather than hoping they'll go away on their own. Finally, trying to save money by skipping professional follow-up care can be a costly mistake in the long run. Regular checkups are much less expensive than treating a recurrent problem that's become severe. I want to share some success stories from my practice to illustrate how effective comprehensive prevention can be. I have patients who had severe ball of foot pain that was significantly impacting their quality of life. Through proper treatment followed by comprehensive prevention strategies, they've been pain-free for years. One patient had recurrent Morton's neuroma that's been treated multiple times with injections. By addressing her biomechanical problems with custom orthotics, changing her footwear habits, and maintaining regular follow-up care, she's been completely pain-free for over 5 years. Another patient had severe fat pad atrophy that made walking extremely painful. After liposana injections and implementing a comprehensive prevention plan, including supportive footwear and regular foot care, she's been able to return to her normal activities without pain. These success stories illustrate that with the right approach, ball of foot pain doesn't have to be a recurring problem. The key is taking a comprehensive approach that addresses all the problems that contribute to the problem. As we wrap up our Ball of Foot Pain 101 series, I want you to remember that prevention starts with small changes that makes a big difference. You don't need to overhaul your entire lifestyle. Simple, consistent changes in your daily habits can have a profound effect on your long-term foot health. If you found this series helpful, Please take a moment to like this module, comment below with any questions you might have, and share it on social media to help others who might be struggling with similar pain. Be sure to hit the subscribe button so you won't miss future content about foot and ankle health. Don't forget to download your free copy of my comprehensive guide to ball of foot pain at www.balloffootbook.com. It includes detailed information about everything we've covered in this series, plus additional prevention strategies and treatment options. If you're currently dealing with ball of foot pain, or you've had problems in the past and want to make sure they don't return, remember that professional guidance can make all the difference. Prevention is always easier and less expensive than treatment, and early intervention can prevent minor problems from becoming major ones. The link to request an appointment is in the description below. Whether you need treatment for current problems or want to develop a prevention plan to keep problems from returning, we're here to help. Thanks for joining me for this comprehensive series on ball of foot pain. Remember, you don't have to live with foot pain, and with the right prevention strategies, you can keep your feet healthy and pain-free for years to come. Take care of your feet. They're the only ones you got. Thanks so much for watching, and have a great day.